Hi, I'm Steve Adubato. During these very challenging times, actually, we're taping on the 8th of April. These programs will be seen later. All of us in the world of media are trying to find different ways to communicate and connect with others and do our programming. I'm actually out of our home, and we are now joined by a very good friend who's been on the front lines from day one, Mike Marin, who's the president and chief executive officer of Holy Name Hospital. Mike, how you doing, my friend?
I'm doing well, Steve. Thank you.
Mike, before we get into the bigger picture of the coronavirus and its aftermath, because this program will be seen later, we're not the news. NJTV News does that. Metro Focus does that every night.
Right.
Mike, you have been affected, impacted by this virus personally. Please talk about it.
Correct. So March 17th was when I was not feeling well, St. Patrick's Day. My staff had come to me and said, you don't look right. They came in with the thermometer and, took my temp, which was actually normal. So I said, no, I'm fine. I'm fatigued. I've been working long days, not eating. I think that's what really all it is, nothing more than that. And they said, no, you just don't seem right. And so they swabbed me. And then my wife started to show symptoms, so they came and swabbed her same day at our house. And both our tests 4 days later, because back then the testing was significantly delayed, came back positive. So once they saw that, I self-quarantined at home and was, for the first couple of days, doing video calls like this, meeting with staff, conducting and running business, doing that literally 16 hours a day, all day long. And then towards the end of that week, I just crashed because every time I got frustrated, every time my stress levels went high, my body just could not compensate for it, and I would crash. And when I say crash, I would fall asleep for 5 hours. I normally only sleep 6 hours a night anyway, and that's it. And here I was probably sleeping at least 15, 16 hours out of every day.
Mike, let me ask you this. You've been on, actually, go on NJTV News and look at the interview that Mike actually recently done as we're taping this with Michael Hill, our colleague. Mike, big picture, long term, as I said, we are not the news. We're trying to understand the lessons of this horrific pandemic. What is the biggest lesson you have taken away so far that we need to remember moving forward?
Well, I think, look, the lessons are going to be enormous in this, Steve. There's going to be so many. The biggest one to me is, rather than looking through the rearview mirror and sort of challenging why we didn't do this and criticizing why that didn't happen, to me, that's not productive in that way, trying to lay blame. What I have found and what we've seen here firsthand, I've experienced it, and I think all my colleagues would agree with this. As a health system, we are 100 million times more efficient, more effective in treating the communities that we're here to serve, which we all have to remember is our number one priority. We are so much better when we collaborate and work with each other rather than compete and undermine each other. And that's not just the health systems and the providers, that's the payers and the supply chain and the entire industry, all the complex components that make up this industry. When we really work together and we put aside all that sort of financial economic drivers that we compete on and say, no, this is about innovation, quality, sharing ideas, and really, really caring for the communities that we're charged to care for, we can be the U.S. health system by far is the best in the world. There's no doubt. We could be so much better, so much more responsive. The other is, for independent organizations like Holy Name, we never merged into any of the large systems. There are a number of us around, right? There's a number of us that are around, and I would say very viable, right? Holy Name falls into that category. If this doesn't demonstrate to the world that we are necessary, we are all necessary, I really shudder to think what would happen if Holy Name weren't here right now because of the other competitive metrics. If we had gone out of business at some point over the last couple of years, like so many other hospitals have, it would be devastating. this community would have suffered untold catastrophe that we managed to intervene and at least mitigate. We couldn't eliminate it, but we certainly mitigated.
Mike, let me follow up here. We've had a long history together, and you and the folks at Holy Name have been very involved in Haiti, building a hospital there, providing critically important hospital services and healthcare there. You're extremely concerned as we tape right now on the 8th of April about what is going to happen with this virus in Haiti. Talk about it.
So Haiti is, as if people don't know, very, very dense population. People literally live right on top of each other everywhere. There's millions of people. It's probably closer to China and India living conditions, much more so than anything we're accustomed to here in the United States. The government has no control. So any request from the government to social distance and quarantine is going to be ignored and laughed at. And the population right now is probably as unhealthy as it's ever been. There's been severe malnutrition down there over the last year because of the political uprising and the economic condition in Haiti. There's the adequacy of supply doesn't exist. We hear everybody on the news talking about the lack of ventilators here, and we're going to get them out of the national stockpile. There's no ventilators in Haiti. Our Hôpital Sacré-Cœur, our hospital in Milo, 200-bed hospital, has one ventilator. One. So it's because it's normally not needed. So down there, and there's no way I can get them ventilators now. It's just not going to happen. So I'm very, very concerned. If this spreads, and it's already in Haiti, it's not that Haiti's been exempt, it's there. Now we're just watching its rate of transmission and how far it's going to spread. We've already had one positive case at the hospital. Fortunately, the woman was strong enough and we were able to discharge her home. But it's going to be a real challenge there. There's no doubt about it.
Mike, before I let you go, how hopeful are you? Because again, this is looking longer term. Yeah. We'll be talking to people, including the governor and the Senate president and the United States congressional delegation in New Jersey, as well as Senators Booker and Menendez. What do you believe, Mike? How confident are you that we will learn meaningful lessons from this to prepare ourselves, whether it's this pandemic, some other crisis? How confident are you that the competition issue you raised and others, that we truly will learn and not repeat these mistakes?
Every day, Steve, I get more and more confident. I got to tell you something. Governor Murphy calls me, texts me every day, 3-4 times a day. His engagement in this has been nothing short of amazing. Senator Booker recorded a beautiful motivational video for our staff to listen to keep them up. Senator Menendez and his staff have been in contact with us, same thing, almost daily. Congressman Gottheimer and Pascrell, they're all stepping up in a big, big way. I cannot in any way. They have been incredibly supportive. And so I am very, very hopeful with their leadership and with them pressing that we can actually change this system.
Mike, again, before I let you go, there's a holyname.org, and we'll have it up throughout the entire segment. There's a holyname.org website that is asking people for donations for personal protective equipment. 30 seconds on that, please. It's been up the entire time.
Sure. So right now, we're the predominant is for funds. Believe it or not, there's a lot of knockoff and not quality PPE being circulated out there. So we won't turn away any donation, but we've had a lot of donations we can't use because it just doesn't meet the standard for us to protect our staff. So money is a lot better. Our materials, supply chain staff here have been working tirelessly. They've been managing to secure it from quality sources, which is critical to us to protect our staff. So that's absolutely essential. And if I could, Steve, I'd like to just add one point sort of tie in Haiti to here. One of the lessons we learned, and you and I have talked about this in the past. So in Haiti, there are no resources. If any, you have to be incredibly creative and innovative as to how you meet the needs of the population down there. That experience we have has now come back and benefited Holy Name through this crisis. And let me tell you some statistics. So before this hit, just 30 days ago, think about the time frame. Holy Name only had 19 ICU beds, and we had 10 negative pressure rooms. And a negative pressure room is one where the airflow is out. The air in the room is sucked out at such a high volume, any virus that's in the room goes out through a HEPA filter and a vent to the outside. So when you're outside the room, you're actually in a safe zone. No virus is coming out because we intensify the airflow out of the room through an externally vented vent. We managed in 30 days to go from 19 ICU beds to 120. And we managed to take our negative pressure rooms from 10 to 250. That is an incredible, incredible engineering feat.
That's right.
And a lot of that came from my staff's innovative capability to be creative from our Haiti experience.
Mike, most importantly, we'll have that in the holyname.org website up the entire time. Holy Name was hit. You and your team were hit. The community in Bergen County hit in a way that no other community has been. To you and your team, stay safe, stay well. It sounds like a cliche, but it's so important. And can't thank you and the doctors and the nurses and all the other team, the folks at Holy Name for everything you're doing. Thank you, Mike.
Thanks, Steve. Yeah, I get to do these interviews, but let's never forget they're the real heroes. They really are.
They sure are. Thank you, Mike. Stay well.
Thank you, Steve. Appreciate it very much. Stay safe.
You too. That was Mike Marin. I'm Steve Adubato. I'm coming to you from our home, just like everybody else. We'll be right back. Make sure you stay home right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, the Russell Berry Foundation, Horizon Blue Cross Blue Shield of New Jersey, New Jersey Board of Public Utilities, Clean Energy Program, New Jersey Sharing Network, the New Jersey Economic Development Authority, Kessler Foundation, the Port Authority of New York and New Jersey, and by Summit City MD. Promotional support provided by Insider NJ and by the New Jersey Business and Industry Association. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.